Well, good morning, everyone. It is another fantastic Monday morning here at Health Plan Markets. It is May 15th, 9:02 a.m. Thank you for being on the call live. And thank you for being a part of our mission. And that mission is to improve the lives of our community with affordable health care. That's why we're here. That's why we do what we do every day. So I really appreciate everybody's focus on that mission. And we've got some great information here today. Unfortunately, it has a lot to do with compliance, which I know is not always the most fun topic to talk about today, but definitely want to ensure that you guys are on the up and up on some of the changes that are happening with CMS, so you can gear up and get ready for the next selling season, as well as prepare yourself for lock-in, which is what we're doing now, and be the best you can be out there. So in order to be the best you can be, you've got to have one foot in the classroom and the other one in the field at all times. And so let's jump over to the training calendar very quickly this morning and go through a pretty busy week for training. Pretty excited about it. Today we are doing a training with Devoted at 3 p.m. Service devoted to you and your clients at Devoted. So there it is. That's today at 3 o'clock. So if you're offering Devoted healthcare or you're considering it, this is a great opportunity to get a little bit of insight on what those navigators do for your members. Okay, talk a lot about that most recently as far as a value prop for your members there. Also today, United Healthcare is doing a virtual office session. That's at 4 o'clock. So any questions, comments, weird remarks about United Healthcare, they can hear it live from you at 4 o'clock today. Just jump on there. That's anywhere in the country you're at if you have questions about United Healthcare. Jumping over to tomorrow, really excited about this one. Those of you in the Orlando market, I highly, highly recommend that you take some time and go over to Optum on Colonial Drive, 7242 West Colonial Drive. We will be co-hosting a how to create and execute a successful doctor office marketing tabletop event. That's a mouthful there, but basically, how are you working with doctors? How are you setting up tabletops? And learn from the best here. So Optum is going to be hosting that at their office on West Colonial Drive in Orlando. This is worth a drive. This is worth you going over there. And number one, if you're a veteran, this is a great just kind of, recap on good practices and things you might be missing. Secondly, it's a way for you to meet Optum and the marketing team that's out there doing tabletops. These guys will go to work for you, but they're not just going to call you and wake you up. Like, they got to know that you're out there doing what you're doing, right? So go out there and shake some hands, kiss some babies, whatever it takes to get in front of these Optum folks. But they're going to teach you how to do a tabletop the right way. Okay, so if there's one training that you go to this week, it's got to be that one. Right now, the top producer at Health Plan Markets, I'm going to tell you the secret, and that secret is she's doing tabletops every day. Every day. Every day there's a tabletop. And that's why she's number one on the top of the board. There's no secret sauce to this. It's just going out there and getting exposure and traffic. Traffic turns to prospects. Prospects turn to leads. Leads turn to appointments. Appointments turn into sales. Sales turn into commission. Commission turns into food on your table. Okay, guys? So that's the equation there. It just rolls that way. It's how the ecosystem works. So tabletops. If you need help with tabletops, we're here to help you with that. Please remember, the entire team wants to help you file these properly and get you the supplies that you need to do tabletops. But this is going to be, a basics training tomorrow at 9:30. This is the secret sauce that's working right now. I hope that everyone takes advantage of that. All right. Also tomorrow, 11 o'clock, Devoted's doing an open training session. So if you're new to Devoted or you need a brush up, this is a good opportunity to do that tomorrow at 11. Also, Cigna tomorrow at 4 o'clock is doing retention training, best practices, what to do to retain your members. This is across the country. Join that. That's a remote training there. Everyone should be mastering retention. If there's one thing you got to know how to do, it's retention. Because if you got a leaky bucket and you're just filling it full of water and your members are just leaking out of the bottom of the bucket, you're just spinning your wheels. So you got to have retention down pretty good. There's a training on that tomorrow at 4. Moving over to Wednesday the 17th, 9 o'clock. There's another training for devoted, service devoted to you and your clients from Devoted Healthcare. Again, another session there at 9. And then we've got our coffee and chat session with Al Clancy, our very own. If you have any questions, anything at all, if you need coaching opportunities, if you're stuck, if you've hit a plateau, if you just don't know what the next step is, talk to our guru, Al Clancy, and he'll get you back in the groove to make some money. That's on Wednesday at 9:30. Also on Wednesday, 12:30, Cigna's doing another virtual office session for their Medicare line of business. Again, just an open mic. If you have any questions, concerns, rude remarks for Cigna, they're there to listen to those. Also on Wednesday, 3 o'clock, you got Centerwell training you on your mail order pharmacy. This is a great benefit. So if you're not really familiar with this, really take a look at that. It's a good one there. Over on the 18th, this Thursday, Humana is doing a new agent training. We're going to talk a little bit about Humana this morning and another opportunity that we found that could help you. But if you're new to Humana or you are wanting to brush up on your Humana, Thursday at noon, you can check that out. Also on Thursday, 4 o'clock, Cigna's doing their Veterans Health Services and MA. We're going to talk about veterans this morning. Really great niche marketing to work with veterans. There's a big population all over the country. Working with veterans can really get you into places that other agents can't. So that's 4 o'clock on Thursday. Also Friday, 9 o'clock, another veteran kind of geared training. This one's for TRICARE for Life. Lots and lots of questions I get about TRICARE. Can I enroll in a Medicare Advantage plan? Who coordinates the benefits? How does it work at the doctor's office? Your questions are answered. 9 o'clock Friday. Be there. I know many of you on this call have been asking me about these types of trainings, and here they are. So thanks to Al and Tom for putting this all together on the calendar. And then lastly, on Friday at 3 o'clock, you've got an open house at VIP Care in Port Orange. Another fantastic, great opportunity for you to go meet a doctor and get in sync with VIP Care, who is being ultra aggressive with their marketing and growth strategies, and very much hope that you guys take advantage of that for the trainings, because there's a lot of training coming up. And we do hope that you get the basics done before all the certifications start rolling out next month. Yes, next month. Can you believe it? We're going to start 2024 training next month, in less than a month here. So kind of excited about that. But that is the training for the week. Remember, guys, keep one foot in the classroom and the other one in the field at all times. So if you do need the training calendar, you don't have access to it, you don't remember where you placed it, you don't have it on your phone, laptop, or iPad, please send us an email at support@askhpm.com and we'll get you that training calendar and ensure it's synced up and ready to go. In fact, we're going to be sending out an email later this week with all of the great resources that we have at HPM as a reminder, and also to ensure that you guys have those links and you can access them at any time and place that you might need them. So be on the lookout for that email coming soon. All right, let's talk about a selling opportunity here. I have learned that Humana is accepting a very key and critical special election period. Number one, that they did extend the Hurricane SEP, for those of you in Florida, to July 31st, which gives you another 2 months to help people enroll in Humana. But beyond that, they've also started to accept a special election period for other credible coverage. So this one's pretty interesting. If you're a veteran, any level of veteran and on any plan, Humana is accepting an SEP if you select OCC, which stands for Other Credible Coverage, and indicating that that person is a veteran or has veteran benefits. They are allowing that person to enroll the first of the following month. So if you meet a veteran today and Humana looks like a good fit, got their doctors and their medicines, and it looks like it's going to be a good fit for them, you can get them enrolled today for a June 1st effective using the SEP code on the application, OCC, Other Credible Coverage. It's going to ask you for more details. You're going to put VA benefits. That seems to be working. I've heard good news about it. So take that with you in case you bump into a veteran this week and need an SEP to get them enrolled. So there you go. All right. Speaking of Humana, last week we had a very important meeting with our staff regarding some of the changes that are happening with CMS. But the first change that we got wind of is from Humana. And Humana has always been a leader in compliance and always usually the first one out of the gate when it comes to changes. So they have made a significant change that they have rolled out to us, and we are now going to be rolling down to you very shortly here. And that is a brand new script that must be followed when doing enrollments telephonically for Humana. So if you're doing remote applications, if somebody's calling you, if one of your member calls you and they say, hey, you know what, that Humana plan looks really good, that Care Plus plan looks really good, you must follow a new selling script guideline. Now, we feel that this document is very cumbersome. It's not very sales oriented. In fact, it seems like it was written by a legal team. But this is now a requirement from Humana if you're doing remote applications. Now, if you're meeting people in person, you do not need to use this script. I'll be sending out an email shortly about this particular script. In fact, the first move that we're going to make is we're going to create an HPM version of this script because we believe that several other carriers are probably going to follow suit after Humana, where if you're enrolling people remotely, you're going to have to follow this particular script. So this script is not a great thing to follow when it comes to sales, but it is now a requirement. It is mandatory. Again, we're going to have these details very shortly for you on how you're going to follow this script, but it is necessary for you to have this moving forward if you're going to be doing enrollments for either Humana or Care Plus remotely. Again, right now we're going to be doing these enrollments. This applies to virtual enrollments. This applies to remote enrollments. This applies to anyone that you're talking on the phone with and completing an application for. Okay, so if you're with that person and you're there physically, this does not apply. You do not need to follow the sales script. This is only for remote enrollments, virtual enrollments, telephonic enrollments, and we're going to have a full script that's going to include the disclaimer. It's going to include a lot of different talking points. It's not fun, guys, I know, but these are the new requirements for Humana and Care Plus. Again, I'm going to have more details as we go through this. Many of you that were with us during the call recording last year, we created an MAPD checklist. I'm going to be updating that checklist with the script included in it. So all you have to do is just follow the bouncing ball on that. And then open up that script so you can read through it if it's a Humana or Care Plus member. Again, I feel that we're hoping that Humana backs off, but it is very possible because of all the new regulations that are happening with CMS that many other carriers are going to require enrollment scripts if you're doing enrollments remotely, virtually, telephonically. Basically, if you're not in the same room as the member, you're going to have to follow a script. Okay. So just prepare your brain for that. I know it's not fun, but it's there to protect us. Unfortunately, we've been caught in the crosshairs of the call centers and all of the craziness that's happened with them in the last 18 months. But this is life. This is that we've got to deal with. So we'll be getting you that script shortly, and the guidelines and the new checklist that you can follow. We'll create a PDF version of that so you can keep it on your desktop when you're actually doing the enrollment process. We've been talking to Connecture, who is the company that created Medicare Shop for us, for our enrollment software coming up in 2024. This script, we're working on possibly getting this baked in to the enrollment process as well. So it'll just kind of pop up when you're doing your enrollment inside the enrollment software system. So some necessary changes that are happening. Again, guys, these aren't our rules. This has nothing to do with HPM. It has nothing to do with anyone's behavior here. It's just a new rule, a new regulation that Humana is requiring. If you're not in the same room with your members, you're going to have to now follow a enrollment script. Okay, these are the same enrollment scripts, by the way, that are being used by their captive agents and their call center agents, both externally and internally. Everyone's got to follow this script. So we're actually a little bit behind, but we are catching up and getting everybody in compliance and just making sure that you guys know what the rules are on this. I know it's going to be clunky. It's a new thing. Nobody likes changes, but these are necessary in order for you to be compliant when selling a Humana or Care Plus product. Okay. All right. More changes here. So many of you have asked me and part of the staff, CMS has rolled out some new regulations and new requirements for plan year 2024. Those were announced in April. And I did find the document, and I'm going to go ahead and put it in the chat here. Let me see. We're going to go ahead and put that in there. Now, what I'm going to do is I'm going to share my screen and kind of show you what this document looks like. So when you click the link in the chat, you know you're in the right place. This is the new CMS contract year 2024 policy and technical changes to MA plans. So these are marketing rules. These are instruction guides to the health plans. This is all of the above. So instead of going through 724 pages with you today, I'm going to go ahead and just highlight some of the things that you should know about and the key changes indicated by this new rule that's going to be put into effect very, very shortly. Okay. So this was ruled finally on April 5th, and it will go into effect for the next AEP. So we're getting you this information now in May, so you can kind of prep your mind on what you need to be doing and how you need to be going about it, okay? So the first thing that you're going to see in this document is that there is a new 48-hour scope of appointment time restriction rule. So those of you that have been in the business for a while, the 48-hour rule to allow a senior to cool down before presenting benefits is going to come back into place. So if you remember previously, you had to collect a scope of appointment 48 hours before your appointment. Now they're going back to that. Okay. So the CMS has re-implemented the 48-hour rule between the SOA and agents meeting with beneficiaries. Okay. There are exceptions for walk-ins and during the end of AEP and OEP. Okay. It's also going to apply at the last 2 days of the month. So for instance, there's, if somebody calls you the second to last day or the last day of the month, you don't have an opportunity to scope them 48 hours in advance. So those are exceptions to the rule for the scope of appointment. Okay. So the 48-hour rule is coming back. The good news on this is that we have two, not one, but two different ways that you can scope a member remotely. Okay. Remember, you've got Medicare Shop, the enrollment platform, where we can call them and do the scope right over the phone. You can text it to them or you can email it to them. Okay, so you have those options inside Medicare Shop, and it saves it in their profile, so when you do the enrollment, it's right there. The second way that you can do it is in your Spark platform that all of you have access to, where you can actually send them the scope of appointment from the CRM system by text or by email. Okay, so those are two different ways that you can scope your members remotely without having to send it anywhere. I personally recommend Medicare Shop only because you're going to end up doing the application there anyway, and you don't want to have to mess around with finding that scope of appointment later down the road. Okay, so that's the first big rule there. There are some marketing requirement changes that are occurring. So here's what we're going to go through. CMS wants to ensure that beneficiaries have clear and effective communications with agents regarding coverage. Here's several key changes indicated by the ruling, but please note that there are several other marketing requirements that aren't included in the list that I'm about to go through. So there's many more to this, so we're going to have more and more as we go through this, but for the sake of time this morning, I just want to hit the key highlights, okay? So some key changes by the rule here. There will be no marketing events at the same location within 12 hours of an educational event. What does that mean, Justin? All right. So agents have the opportunity to promote an educational event, such as a Medicare 101 or a Medicaid and Medicare training, or how to work with your doctors, or how to find drugs in your formulary, whatever that educational training looks like, that obviously doesn't, pertain to a health plan or their benefits, that's considered education. Some agents were using that as a strategy to set up an educational seminar, and then right after that educational seminar, they'd book a sales seminar for a specific plan, back to back. CMS is no longer allowing that. So you can use the same location. So if you're using a library, you have to wait 12 hours before you do a sales presentation at that same location, in that case, the library. I don't even know if libraries allow you to do sales presentations, but that's just one example. So if you did an educational Medicare 101 at a senior center, you can't do a sales presentation. You can't do like a Humana sales presentation that same day. You have to wait a whole nother day in order to do that at the same location. Okay. All right, here's another one. Limiting the use of the Medicare name, logo, and Medicare card. So we've heard that we will no longer be able to use the word Medicare in some of our advertising. We won't be able to use their logo, and we won't be able to use the Medicare card in advertising. Okay, so this is going to get a little confusing, but we have some ideas around this to kind of skirt it, and we'll share that with you later down the road once we get some clarification of exactly what they are going to allow and what they're not going to allow. All right, marketing information that revolves around savings. So specifically when in regards to the comparison of typical expenses for uninsured individuals, unpaid costs of duly eligible beneficiaries, or other unrealized costs of the Medicare beneficiary. So what this particular section is saying is that there are plans and there are agents that are basically saying, hey, here's the benefits on plan X compared to somebody that does not have any insurance. Or here's the benefits for plan X in comparison to Medicare directly or a dual eligible directly. And one of those big features is dental, vision, and hearing. If you enroll this into plan X, then you're going to get vision, dental, and hearing, and dual eligibles, they don't get that, right? So Medicare is really cracking down on, comparisons and comparing unfairly against somebody that just has straight Medicare, and you're comparing like a dual eligible, or somebody that has no insurance compared to, plan X, Y, and Z. Okay. So Rosie's mentioning, so no more Medicare matchmaker. Well, the good news is we're still allowed to do quoting, and we have a quote engine with Medicare Shop. So you're still, at this point, what I'm reading is you're still able to do a plan comparison, so side-by-side comparison between plans, and you can still send those out as a quote, or work with your members to choose the right plan based on benefits side by side. What they're indicating here is you couldn't put a specific plan against somebody that has just original Medicare when it's not really exact on that person being on original Medicare. So you might be talking to somebody that's on a different plan, but you're comparing them to somebody that has no other plan. They just have Medicare exactly. So I think a lot of that's being confused by the seniors, and that's why they're cracking down on comparing, a specific plan to somebody that has no insurance or somebody that has just straight Medicare and Medicaid. So that's another one that's coming down the pipe. Okay, here's one more. The collection of scope of appointment cards at educational events will now be prohibited. Now, a couple of years ago, CMS said, hey, you can do educationals, you can collect consented contacts, and now, this was a couple of years ago, this says you can go ahead and collect the scope of appointment at the educational event. So starting in 2024, starting October 1, they're saying, no, you're not going to be able to collect scope of appointments at educationals anymore. This is different than collecting consent to contact. Okay, so let me be clear here. Give you an example. You set a Medicare 101 at a library, And obviously you're doing this out of the goodness of your heart, right? You're doing a Medicare 101 for lead generation, right? So you share your expertise with Medicare. At the end of the seminar, somebody says, hey, Justin, I'm really interested in talking to you about my Medicare benefits. Can we talk? And the answer is absolutely, I'd be glad to help you. I can't do it here today, but you can go ahead and fill out a consent to contact, whatever that looks like. If you're using the Spark platform, you can use it on your phone, laptop, or iPad, and they can fill it out, right? And then you get consent to contact, and you'll be able to go ahead and contact that member after the educational seminar, okay? That is different than someone saying, hey, Justin, I'm interested in you talking about my Medicare benefits. Okay, great. Go ahead and fill out the scope of appointment, and I'll see you in 2 days. Okay, that's different. So you're not allowed to do the second part that I just described. You can still collect consents. You just cannot collect the scope of appointment. In my opinion, it really doesn't make that much of a difference, because if the person's interested, they're interested, right? You don't need to collect the scope of appointment right there and then. However, if you've got permission to contact after the event's ended, you can then call them back and say, hey, here's what we need to do. I'll see you in 2 days. I'll send you over my scope of appointment. So you can do it after the event's ended, once you get back in touch with that member. So they just kind of want to have some kind of cool down period between you collecting that scope of appointment and going right for the throat. So, more on that as it develops. And then the last thing is, I don't think this really applies to us as brokers, but words like most or best when referring to Medicare assistance are going to be prohibited in marketing materials unless providing data from the previous year to support that statement. So we don't really do that very often, saying that we've got the best Medicare Advantage plan or, something like that. And if we did now moving forward in 2024, we'd have to back it up with some data. But I think that's more geared towards the actual health plans versus us as brokers. So those are the big key changes that are happening with CMS that I wanted to spend some time here this morning, because I'm getting a lot of questions on this. And, there's still more to come as far as how this is all going to play out. Again, this is going to go into effect in the summer, and it will not affect anything for 2023. But starting October 1, we'll have to follow these new guidelines. And again, we'll send out more information on this as we get it, and especially reminders as we get closer and closer to our selling period of pre-AEP on October 1. All right, so Mark is asking, how do we do the scope 48 hours before the app on Shop? Great question. So Mark, we'll get you with somebody specifically to share that information. But you know what? Let's do this. I'm going to go ahead and log in here to my account, and I will show you exactly how you can do a scope of appointment today and do that 48 hours in advance. Okay, so again, the idea is it's the same process as you're going to do now. Medicare Shop 2024 should be pretty much the same. Okay, but let's say we go over to Mr. Joe Dirt. So we go to his profile here. And let's say you've already pre-created this profile. You guys should know how to do all that. When you scroll down, you'll see the option to continue to scope of appointment here. Okay, so you'll click continue to scope of appointment, and you have 3 options to do this. I've already done this for this person. You can email it to them. If you don't have their email, you can go ahead and plug it in here. You can text them the scope of appointment, or you can complete it in person or over the phone here on this form. Okay. Now, if for whatever reason they still can't do any 3 of these remote options, or if you're in front of the person in a different situation, you can go ahead and print a PDF version of it, and you can click here, and then you can print this out and deliver it as well. Okay. So you have the option of, I guess 4 different ways to do that scope. You just have to make sure that it's done 48 hours in advance, moving forward starting October 1. So I hope that helps, Mark. If you need any training or coaching on that specifically on how to do that, but it's simple as just going down to the scope I'm showing you right here, and you click email scope. It's done, right? It tracks your scope of appointments as well. So, it's obvious I completed this one in person on November 17th, and then there's the confirmation number. So that's why I recommend that you do it in shop, because you kind of have it's all in one place. Your enrollments, your scope of appointments, all of this is all in one place. Okay. If you did do this one that was paper in person for whatever reason, and you have a physical one, you can go into shop and upload it here. So you just save a digital copy, and then you can upload it right in here and save it that way too. You can also view the scope of appointments going back by clicking there, and it will open up a version of the scope of appointment, and there's the version that I'm sharing with you there on that particular one there. So it's pretty easy. I mean, the scope of appointment before was a little clunky when they required 48 hours in advance. But I am going to share a strategy that if I was selling, this is exactly what I would do. Okay. If somebody comes up to you or calls you or texts you and says, "Hey, Justin, I'm interested in joining a plan," as a salesperson, okay, people get nervous if you're too aggressive. Okay. Go, yeah, okay, I'll come over to your house right now. Some people get a sense that you might be a little desperate for the enrollment. So as a salesperson, it looks better if you're super busy. Okay. So from a sales strategy, putting on my sales hat here, if somebody called me and said, "Hey, Justin, I'm really interested in joining that plan that you put my mom on, a couple years ago. I got my Medicare. Can we get together?" And my answer would be, absolutely, I'd be happy to help you. It does look like I'm jammed up for the next couple days here, but how does Wednesday look for you? Is there a good time on Wednesday we can get together? Great, Wednesday at 10 o'clock? Fantastic. Here's what I'll do. Medicare does require me to get your permission to talk about Medicare plans, so what's better? Can I text you or email you a quick document for signature? Justin, I don't have a text. My phone's down and I don't have an email address. Okay, no problem. Let's go ahead and get that recorded right now. Bounce over to your recording software, and you can do the verbal scope of appointment by reading it here in shop. So there's 3 ways that you can do it that way, or you can keep a couple of blank ones in your car too, in case you want to mail them or drop them off or whatever you want to do 48 hours in advance. So that's a way to tackle scope of appointments. Again, you just kind of got to bake it in, guys. It's not going to be too hard to master that. Okay. Bridget is asking, when will we be doing Medicaid training? Medicaid training. Okay. If you do need Medicaid training, please reach out to support@askhpm.com if you need it immediately. But yes, Bridget, I do have that on my to-do list here. There has been some changes for Medicaid. Unfortunately, I can't do Medicaid for all of the states because there's 50 different trainings. Medicaid does vary per state. However, I will be doing one for Florida specifically in a deep dive. So that's more to come on that. So I appreciate your patience on that. But if you need emergency or urgent Medicaid training, I would get with Rosie on that specifically for in your instance. Or you can send us an email at support@askhpm.com, and we'll be glad to get you up to speed on a crash course for Medicaid. So I hope that helps. All right, guys, we're out of time for this morning. One more question here from Kent. How long are scope of appointments good for? That's a great question. Thank you, Kent, for reminding me. Scope of appointments will be good for 6 months. Okay, so starting in October, scope of appointments will be good for 6 months. So if you scope somebody in October, what is that? You'll get all the way through March to use that scope of appointment on that particular person. Otherwise, if a scope does expire before you get back to that person, you can always rescope them. It's not a big deal. If you call them and say, "Hey, can we go ahead and rescope you for another 6 months because we didn't get all the pieces and parts put together just yet," you can rescope them at any point in time, and that resets the clock. So good question, Ken. Tim's asking if during a educational event, we receive a consent to contact, can we send scope of appointment later that day? Yes, you can. You just can't do it at the event. So you can collect the consent to contact, and then the event ends. You go home, you go to your car, you go to your office, and then you call your consent to contacts and say, hey, you requested for me to contact you regarding your Medicare information in order for us to discuss benefits. We'll go ahead and complete a scope of appointment now. And remember, you can do that by text, email, and over the phone. All right, so Mark's asking, if you do a face-to-face, then we must send an electronic scope 48 hours or more before. Yes, you do. So if they say, hey, Mark, come on down, come by my house, you're going to have to play that salesman trick and say, yeah, happy to do it. Looks like I'm jammed up for the next 2 days, but I'll get over to you on Wednesday. 2 o'clock work? Fantastic. In the meantime, let me go ahead and send you over this quick document I need you to sign before I head that way. And that's the scope of appointment. Okay, so that has to be done in advance prior to you going to a face-to-face appointment. Now, remember that that walk-ins are exempt still. So if you go there for one Medicare eligible and then a second one walks in, then that second one is exempt. You don't need to wait 48 hours. Or if it's the last day of the month, or the second last day of the month, you're not going to have 48 hours to get them scoped in order to be effective on the first of the following month. So those are the exceptions to the rules as we know them today. But that 48-hour rule is going to be monitored, and we'll have to kind of go from there as far as how CMS is really regulating this. Great question, guys. Now, my parting thought is this. I know CMS is trying to make it harder for call centers. Unfortunately, it's having an effect on what we do and how we do our business as well. But I will say that it doesn't really impact a lot of our day-to-day operations. The only thing really is just that scope, just making sure that you have a good procedure for your scope of appointments. And then we've got that selling script in case you are going to be doing some remotes. You're just going to have to follow that bouncing ball. It's not going to feel very charming on the phone, if you will. But if you've got great relationships with your members and your clients and your prospects, just let them know, hey, look, I apologize, but I've got to read this script to you before we get started on the enrollment process. This is CMS on how we're doing this. Mark is asking, how long is the selling script? We're working on that, buddy. Right now it is daunting. So, but we're working on trying to figure out a solution to that. And we're going to create our own and submit it to the carriers for approvals. So right now, Humana absolutely is requiring that the selling script starts immediately. So we'll be working with you on that and sending that over to you guys very shortly. Great questions, guys. Now, if you have any more questions before the call ends here today, please send an email over to support@askhpm.com. We'll get your questions answered as quick as possible. Or if it's easier for you, 844-696-3975. Give us a call, and we'll get somebody on the phone for you to answer any questions that you might have. All right. Thank you guys for being on the call. If you need anything, please reach out. We're here to help you. And always remember that these calls are being recorded. So if you need to reference this call back, it's going to live on YouTube later this week. Okay, guys, hope you have a fantastic and successful